Hi, thanks for joining. My name is Mark Maloney. I'm the founder of VenOps. We're a compliance company that specializes in independent medical practices. And I'm also a founder of Indie Practice, which is a platform in partnership with the Medical Association of Georgia that brings ideas that create new revenue, save revenue, and also protect independent medical practices from outside risk. Our guest today, we have two companies. One is Movi. It's a Montreal-based company in the musculoskeletal space, and their speaker today will be Patrick Maiden, their VP of Sales. And another company called Tempeda, and Tempeda is a Phoenix-based company that saves doctors time on the onerous task of documenting and working with their electronic medical records. So our first speaker will be Patrick. Patrick, welcome to the webinar.
Thanks, Mark.
And I am now going to give Patrick the screen so he can show you a few things about how Movi can help practices to diagnose knee pain. So give me a second to change the presenter. And Patrick, the floor is yours. The screen is yours.
I'm going to go ahead and jump off camera and show my screen so you can see what my documents.
I'll do the same.
So where I'm going to start is the typical question I ask surgeons at the beginning of a discussion or any orthopedic. Do your patients typically complain their knee hurts when they're sitting still or when they're actually doing activities? Typically, until they're old enough that it hurts all the time, which we all get there eventually, it's when they're doing something. So why do we keep using static exams like x-rays and MRIs to determine what's going on in a moving knee? And the correct answer cannot be because we've always done it that way. So what the KneeKG provides is a 3D dynamic exam of the knee in motion. It's using the NDI camera system like they use in the surgical robots. It takes the patient walking on a treadmill for roughly 5 minutes and then a 2-minute exam session to be able to get the data. It fits value-based medicine because it helps get the patient on their best pathway more quickly. With the report, it makes recommendations for treatments based on the actual mechanical alignment of the knee and how the knee is actually functioning. So you get that patient on their best pathway more quickly rather than the things I experienced as a multiple time knee surgery patient with first visit, let's give them anti-inflammatories. 2 weeks later, let's give them an injection. 2 weeks later, let's send them to PT for 4 to 6 weeks so they then qualify for an MRI. And then after we get to the MRI, 6 weeks later, then they're a surgical patient. So what the KneeKG will make recommendations for is bracing or orthotics or a home-based exercise program or even exercise in your PT, or it'll even make recommendations for a surgical consult. So it can help get that patient on their best pathway more quickly. There are billable reimbursable codes. It's 96000 and 96004. Last year, CMS average on those was around 220. Commercial was as high as 400. It also fits the work comp space very well. And we've actually got a doctor getting ready to try it on the auto and personal injury side as well. It does also fit in the opioid sparing side of pain management for OA patients. The Academy of Orthopedic Surgeons used it as part of their guidelines for OA patients 2 years ago. And in that, it was able to show a 42% reduction in pain just by doing the correct exercises and targeted therapeutics that were provided by KneeKG. And with the No Pain Act going into effect, it's definitely a good way to help keep those OA patients in your practice, especially with the longitudinal bundles that are becoming such a big part now, and getting them taken care of early by getting the KneeKG done initially, and then having it done on a regular basis to make sure that things are going well for that patient. And just to give you an idea of kind of what you see on the reports themselves, the entire report is on the back of this page. So you see the alignment throughout their entire gait cycle. But on the front of the report, we're actually focused on the things we want to correct. So this patient was an OA patient, had a varus thrust during loading and varus alignment during stance. And because of that, the patient was giving targeted neuromuscular retraining exercises at home, as well as a knee brace to help correct their alignment issues. And then the patient, I mean, obviously, any of us at this point see the positive on BMI. I love to say what my surgeon says there. Every pound you lose is 4 pounds of pressure off your knee. So that's something else to keep in mind. But the KneeKG can help reduce pain, improve function, and get patients back to normal function more quickly than just the current standard of care. That's kind of the easiest way to look at it.
That's amazing, Patrick. Let me turn my camera back on. Is it okay if I ask you a few questions today?
Absolutely, sir.
So, what would be the ideal practice? Within the medical association, within indie practice, we have primary care. All of the medical specialties can be independent: musculoskeletal, orthopedic, podiatry. What's the ideal practice look like?
So the best fits so far seem to be an orthopedic office that has a full spectrum. So it's not just surgeons, it has primary care sports med folks, because this fits very well with the primary care sports med side. We also do have a regenerative orthopedics and sports medicine office up around DC that is showing great success with it. And then there's some interest on the PM&R side as well, because pain management and rehab doctors, again, especially when you get into the DOs and the physiatrists, this is right in their wheelhouse in helping patients reduce pain and avoid surgery. So this works really well in all of those. But we've had it fit in PT. The billing's just not as good. We actually have some interest from some chiropractors as well in using it as some of their analysis. So, but primarily the primary care sports med, regenerative, and maybe PM&R.
And what do you think would be the ideal patient, in your opinion? Age, BMI, or what have you found so far to be like the ideal patient to get the most out of this?
So the indication of use is just knee pain or dysfunction of an orthopedic cause. So it can really fit almost any knee pain or dysfunction diagnosis, and be used and billed and reimbursed there. But the ones who are going to get the most lifelong benefit of it are the early stage knee OA patients, or the athlete that's had multiple knee injuries, and that's the path they're going to follow in the long run. Is they're going to develop OA, they're going to end up eventually with a total. This helps prolong that and help push that total knee off farther. But then for those total joint surgeons, it's actually a good fit there as well, just simply because that 1 in 5 average of patients that come back unhappy after they're having their total joint, this gives an opportunity to help improve their function and reduce their pain post-op if it's that complicated patient, and they can avoid a revision by doing the KneeKG potentially, and getting the patient on the correct exercises and therapeutics.
So if I'm a patient with knee pain, is it an exaggeration to think that if I took this exam, I would know why my knee hurts?
Exactly. It would give you specifically what part of your gait there's dysfunction and what things can be corrected to help fix that. Okay. Rather than just the I'm getting old, so my knee hurts, or my knee hurts when I do this, and then the doctor says, okay, so don't do that.
And it can do that without having to go get an MRI or a CT or other types of.
And it wouldn't take 4 to 6 weeks of PT to qualify for this. This can be done as early as triage.
Okay. So describe the kind of a test that a person would go through. How long does it take? Is it painful? How active does the patient have to be?
Patient just needs to be able to walk on a treadmill, roughly for 5 minutes as a warm up, and then 2 45-second segments of recording. So about 7 minutes on a treadmill is all they have to be able to do. Ideally, we like them to not have to hold on to the treadmill, just simply because that causes a little bit of lean and sway in their gait. But there are ways to adjust the data if that's necessary. But in a perfect world, someone who can walk into their own body weight for 7 minutes. And the whole test takes roughly 15 to 20 from patient in to patient out.
That's not very long at all. So if I'm a smaller practice, an independent practice, can you give me some ballpark numbers on what my investment would be?
So we've actually got multiple rental options and purchase options at this point. The most common one we're seeing is the 5-year rental that includes 20 tests a month, and that's $1,499 a month for 5 years. And the reimbursement is anywhere from $220 to $400 on average. So, I mean, it's not a big ask or a big risk financially to be able to get data you can't get anywhere else and improve patient pain and function and get faster diagnostics and fit value-based and all of the good things.
Okay. Well, you know, the three pillars that we have at Indie Practice are it creates revenue, saves revenue, and protects them from outside risk. Sounds to me like it would easily create new revenue, and that additional information might then protect them from additional risk down the road of not having as much information as they might need to make a good diagnostic.
Actually, and the sustains revenue, the idea with the longitudinal bundles is to keep that OA patient coming back to your office instead of getting sent somewhere else and then coming back when it's time to have surgery. So
Super.
if they're coming in over time and having the KneeKG done even on an annual basis, that's keeping them coming into your practice.
Great. Well, can't thank you enough for joining us today. I'm going to transition now to the next company, which is Tempeda.
Thank you, Mark. I'm going to go off camera.
Yeah. Please stay with us. Thanks. So the next company is called Tempeda, and it's a software as a service, and it's designed to basically shave up to an hour a day of time from a doctor's use of their EMR. And everybody knows that EMRs are, depending upon your perspective, either a great help or just the devil incarnate. And physician burnout is often attributed to EMR usage and the input required from that. So the information gained from electronic medical records is hugely useful, obviously. When we rolled out one of the first EMRs in 2001, it replaced huge amounts of paper charts, saved money. And the good thing about an EMR, it never forgets anything, it never loses a chart. It's obviously a lot easier to use in many respects. But that documentation, the time is challenging. So what Tempeda does is it simply saves a lot of time. So I'm going to show a couple of videos real quick that will explain by the creator of the software program, who's an orthopedic surgeon named Dr. Kishore Tipernini, of how this works.
Tempeda. Tempeda is an intelligent medical documentation assistant that dramatically speeds up medical documentation. This quick start tutorial will explain how to get started using the app. Tempeda can be used on any desktop or laptop computer using an ordinary web browser. We recommend using either Chrome, Firefox, or the Microsoft Edge browser. Safari and mobile devices like phones and tablets are not supported at this time. When you first log in, you'll be presented with this Tempeda editor. The editor is where you will generate your notes, which will then be transferred into your EHR system. To start using Tempeda, click the Open button to open a template. You'll be presented with the Open dialog with 3 tabs on top. The Mine tab will show all templates that you've created or favorited. When you first start out, this tab will be empty. Go to the Public tab to find templates that are publicly available for your specialty. The strategy for getting started with Tempeda is to first get templates from the public library of some of the most common clinical problems you see in your practice and copy them to the Mine tab for your personal use. As you get familiar with these initial templates and incorporate them into your practice, you can obtain or create more templates. Your eventual goal should be to generate 70 to 80% of all your clinical notes using Tempeda. There will always be some complex patients with complex histories or treatment plans for whom an ordinary dictated note will be most efficient. When you first start using Tempeda, you'll want to copy some of the publicly available templates to your Mine tab for personal use. You may want to start out with less complex notes like post-op notes or routine op notes as your initial templates. You can type into the search field to search for templates. You can type anything, including a diagnosis or body part, to search for a template. For example, if you're looking for a template for Deeker veins tendonitis, simply type the first few characters. As you can see, templates are organized by the stage of treatment for a patient. For Deeker veins, there are templates for the initial visit, post-op visit, and others including surgical notes. All surgical notes in Tempeda should start out with SURG to indicate that they are surgical reports. To open a template in the editor, simply click on the one you're interested in. We'll open up this initial visit template. There are 2 sections to a Tempeda template. The section above the red line is called a header and contains all the selections available to complete a note. The lower section, called the body, contains the actual note. To use a template, simply select the appropriate items in the header for a particular patient, and the note in the body will automatically be generated for you by Tempeda's AI. The selectable items are all colored blue, and these items are called fields. Remember that you only need to select the items in the header, the area above the red line, and the lower portion, the body which represents the actual note, will automatically change for you. For example, on this template, which covers both Deeker veins and ECU tendonitis, I can select which side the patient is having symptoms on, how long they've had symptoms, and also what type of tendonitis it is, whether it's Deeker veins versus ECU tendonitis. I can also select if I've done x-rays on this patient in the clinic, or if I've read x-rays from an outside institution. And also what my plan will be. I can select from my list of plans that I've created and select the plan that I want. As I make these selections at the top in the header, the note for me automatically reflects these changes. For example, you can see the assessment plan here shows that I plan on doing an injection for this patient for their tendonitis. If I change the plan from injection to a brace, then the assessment automatically changes the text to reflect that selection. Once you have finished selecting the items in the header and Tempeda's AI has automatically generated the note for you, click on the Preview button to go into Preview mode. Preview mode allows you to view what your completed note will look like, but also copies the entire text of the note onto the clipboard. Once you are in Preview mode, you can simply switch to your EHR system and paste the copied text into a new note for the patient. Besides Preview, the other 2 modes are the Edit mode and Design modes. The Edit mode is the mode that displays the selections in the header for you to complete a note. This mode is the initial mode the editor will be in when you open a template. Design mode allows you to modify a template and the logic of how it works. To get started using Tempeda, you should select 10 to 20 templates from the public area and move them to the Mine tab for yourself. There are 2 ways you can move a template from the public area to your Mine tab: the favorite method and the save as method. To favorite a template, simply click on the star icon next to a template that you're interested in. Alternately, if you have a template already open, you can click on the star next to its title. Whenever you favorite a template, it will show up in the Mine tab for your use. So we favorited 2 templates here. So now if I go to the Mine tab, these 2 will now show up under this tab. You should use the favorite method for moving a template to the Mine tab only if you're completely satisfied with how the template works and you don't need to modify it. In Tempeda, you can use any available template, but you can only modify the logic or original text of the templates that you are the owner of. If you want to move a template to the Mine tab, but also want the ability to make some modifications to the wording, use the Save As method. The Save As method makes a private copy of a template into your Mine tab that you are the owner of. To use the Save As method, search for a publicly available template that you are interested in, and then open the template. Once the template is open, click the Save As button to save a private copy of this template for yourself. You can give the template a different name if you want, and then select Save As Private to store this template into your Mine tab. You can now see if we click the Open button, there should be 3 templates under my Mine tab. But only the carpal tunnel initial visit template is private and only accessible by me. Also, since we use the Save As method to save this to our Mine tab, we can modify this template because we are now the owner of it. To modify a template, you can simply click on a template that you own, go into design mode, make the changes you want, and then click the Save button. Once you have copied some templates from the public area to the Mine area, you are ready to start using Tempeda in your clinical practice. To use Tempeda, simply log into your EHR system and also log into Tempeda in a separate browser window. Then when you need to document on a patient that you have a template for, open the template, make the appropriate selections in the header area for the patient, click the preview button, automatically copies the note to the clipboard, then switch to your EHR system and paste the text into a new note. If there are any minor changes you want to make to the text, you can do so once your note is pasted into your EHR system. It's that simple. Modifying and designing your own templates isn't hard, but may require some training. We at Tempeda want to handhold you through this process. This is why we recommend that you sign up for a free in-person training via a Zoom meeting to learn how to do this. By signing up for Tempeda, you should have already received a welcome email from our support team inviting you to set up a training session. It's highly recommended that you do this to get some training on creating or modifying your own templates to make them more to your liking. For those that are tech savvy and want to try to train themselves on creating and modifying templates, please go to the videos under the Help tab labeled Basic Functions and Creating Templates. This concludes this Getting Started video. We highly recommend that you watch the Basic Functions video located under the Help button to learn more details about the basic functions of Tempeda. Thank you. Hello, and welcome to this demo of Tempeda, the new AI-based software that can... Welcome to the Tempeda Advanced Functions video.
Okay, that was very illustrative. Now there's 2 parts to Tempeda. You just saw one, which is the AI-driven templating components, which can save a tremendous amount of time. And the other part is called autopilot. And what autopilot does is that at the end of every inputting session, there is, say, 10, 15, sometimes 20 button clicks where a physician has to put the information in, click the order, push it into a different screen. And every EMR has such repetitive tasks or clicks. Tempeda can automate all of that so that all you have to do is hit one button. So let's just see how this works. Let me show my screen again. And hit go.
This video covers some of the advanced features of Tempeda related to smart fields. The topics in this video are meant for tech-savvy users who want to program their own templates.
Oops, I just hit the wrong one. Forgive me.
The video you are watching is of a patient being checked out of a common EMR system. What's truly remarkable about this video is that it's not a human that's performing this task. These clicks and the other steps necessary to check out this patient are being handled by a new artificial intelligence called Tempida. Tempida is visually aware and can actually see the screen to move the mouse to the proper locations to perform its tasks. This particular demo is on a Cerner EMR and is being run at a slower than normal speed so that you can see Tempida work. But Tempida can be trained to work on any EMR to free physicians of repetitive, cumbersome tasks, allowing them to be more efficient. Tempida can even handle clinical note generation. But how does all this work? Let's start at the beginning with a demo of how Tempida generates the clinical note. The Tempida note generator works with any EMR system and is accessed by a simple web browser. So to access your templates, you simply go to tempida.com and log in. Once you log in, you'll be presented with this Tempida editor in your web browser. The problem with templates in many EMR systems is that the templates are not intelligent. They can't handle complex clinical scenarios. For example, even on a common problem like carpal tunnel syndrome, there's a lot of variability. Variables such as how long the patients have had symptoms, what kind of treatment they've had, and my clinical plan make static templates useless. As a result, most physicians still choose to dictate their note, which is an incredible waste of their time. To open a note for the patient, you simply click on the Open button. There are over 250 publicly available templates already set up for orthopedics inside of Tempida, but you can create and customize these to your liking. To search for a template you're interested in, simply type what you're looking for, and then click on that template to open it. Templates in Tempida are divided into two sections separated by the red line. The upper portion, called the header, is where you'll make your selections for a particular patient. The lower portion, called the body, is where Tempida's AI will automatically generate the note for you based off of the selections. So for example, on this patient, I simply have to select which side they have symptoms on, how long they've had symptoms, some physical exam findings, if they've had x-rays or not. If they did have x-rays, I can select if they were done in my clinic or they were done at an outside institution. And Tempida's AI will automatically generate the x-ray report for me. In fact, as I'm making the selections at the top, the Tempida AI is automatically changing the text at the bottom to reflect these selections. So for example, since my plan right now is surgery, you'll see that under the assessment of plan, it reflects that I will be doing surgery on this patient. But if I change my plan from doing surgery to doing an injection, I simply make that selection and the Tempida AI automatically changes the text for me. So even complex clinical notes like this take only a few seconds due to the power of Tempida's AI. So once I generate the note in the Tempida documentation system, how does it get into my EMR? That's really simple. I simply click one key on my keyboard and the Tempida Autopilot AI takes over. It will click the preview button to copy that note to the clipboard and then sign my orders that I've already pre-selected. Then it will go into the visit summary and create a visit summary for this patient. Sign that visit summary. And then it will go in and create a new note for this patient. And then it'll paste the text that we've already created in the Tempida documentation system into the new note. All of this happens automatically without me having to be at the computer. I could simply go on and see my next patient. The AI has finished generating this office note and finished checking out this patient. Tempida can handle any type of text-based notes, including op notes. So for example, if I'm doing a total knee on a patient, I'll simply open the template, make the selections at the top, like the side that I'm doing and the size of the components that I'm using. And then Tempida's AI generates the entire note for me. If I click the preview button, this gives me a preview of what this note will look like, but also copies its entire text onto the clipboard, which can then be pasted by the Tempida Autopilot application into the EMR. I've been using the Tempida system in my practice for over a year and has increased my revenue generation by 30%. This is because I spend less time documenting and doing mundane tasks and more time actually seeing patients and diagnosing and treating them. Since Tempida is completely cloud-based, any templates that anybody wants to make publicly available are available for any other physician in the system. Since your templates won't be locked into an EMR system, even if you decide to move practices or you work at multiple locations that are on different EMR systems, your templates are always available for you via the cloud. For more information, please go to tempida.com to sign up for a free account or see more features. Thank you.
So that concludes today's webinar, and the Tempeda can, like Dr. Tiffany said, work on any EMR, which is a kind of miraculous. It's browser-based, and it saves him easily an hour a day. And like you said, he is able to increase his productivity in the first year by 30%. So, Patrick, thanks again for joining us. I appreciate your time very much.
Glad to do so.
Yeah, I wish everybody a very good day.
Thanks, Mark.
Take care.